Okay, so good morning all. Starting off with today's lecture. Today's lecture will be on finance and dental care. So, starting off with the introduction, traditionally healthcare services have been provided as a fee for service basis. So, what happened? Basically, the patient receives specific services and pays the provider or the dentist directly for whatever services he has availed. Okay. As the cost of healthcare continues to rise, methods to ease costs either by legislation or by development of a variety of funding approaches. Okay, so in the developing countries like India, very few people can afford to utilize oral healthcare services regularly. Okay, so here the majority of the population is focused on curative services, and like very nil, or you can say very few population is concerned about preventive services. So as the cost of dental care rises, majority of the people cannot afford dental treatment. Okay. So in response to the barriers faced as a result of not being able to afford the cost of healthcare, various concepts and mechanisms of financing are born. Coming to next, that is mechanism of payment. So basically there are five mechanisms. The first one is private fee for services, second is post payment plans, third is private third party prepayment plans, next one is salary, and the last one is public programs. The third one, that is private third party prepayment plans, is further divided into four categories. The first one is commercial. The next one is non-profit health service corporations. The next is prepaid group practice, and the last one is capitation plans. Okay, so in non-profit health service corporation comes the Delta Dental Plan and Blue Cross Blue Shield. Okay, so coming to the first mechanism, that is private fee for services. Basically, it is two-party arrangement. Okay, as you can see here, it is basically known as two-party arrangement. Okay, so who are the two parties? The first party is the dentist and the second party is the patient. Okay, so it is the traditional form of reimbursement for dental services. It is an integral part of private practice as a delivery method. So the advantages of this are culturally acceptable, flexibility, administratively simple, and the most important, it is time saving. The disadvantage of this is major percent of population cannot afford dental care, as I have already told. The next one is post payment plans. It is also known as budget payment plans. The individual purchases a service and the payments are made at intervals over a period of time. Okay, say for an example, like if somebody wants to buy a house or a home, but he does not have that amount, okay, that total amount, then what he will do, he will take loan from bank and just pay the property dealer or whosoever he is in contact with for the purpose of buying the house, and he will just return that loan in increments to the bank. Okay. Okay, so what it is? Patient borrows money from the bank or finance company. The application is approved by the lending institution. The dentist is paid the entire fee for his service. Then the patient repays the loan to the bank in budgeted amounts. Okay, so advantages of this are helpful for middle income people, primarily used to finance prosthetic and other costly treatment. Disadvantage is lower income people are not thought to be credit worthy by lending institutions. This system is not in use in India and difficult to be implemented as we have majority of low income people. Okay, so coming to evaluation, this is basically for what you have learned from this. So this is scenario one where the patient visits a dental clinic where he is advised by the dentist to go for oral prophylaxis. Okay, the patient undergoes the treatment and pays the dentist directly. Which type of financing mechanism is followed here? See, basically the patient has availed oral prophylaxis and is paying the dentist directly. Whatever the charges of oral prophylaxis, just ask the patient to pay for. Okay. So it will be private fee for service. Okay. Okay, so the next mechanisms will be covered in the further